Hey, how are you today, little girl? Are you ready for your NCLEX review? Okay, so today we're going to be going over anticonvulsants, high blood pressure drugs, and Synthroid. Okay? Alright, let's begin. Today we're going to talk about anticonvulsants, which is mainly used for seizures and epilepsy, hence the reason why it's usually called an anti-epileptic drug or an anti-seizure drug, right? Basically, what it does is it inhibits seizure activity, okay? Now, it can also be used as a mood stabilizer, right? So, therefore, it can also be used for treating bipolar disorders and other personality disorders. And also, let's quickly go over how anticonvulsants work. Basically, the mechanism works by blocking the sodium channels or the calcium channels, or on the opposite spectrum of that, it can enhance the GABA receptor, which is basically an inhibitory neurotransmitter. And obviously, our main goal is to reduce excitability in the central nervous system or in the CNS, which will hopefully reduce and calm down any muscle spasms, right? The patient has. Now, I'm going to go over three categories. These are the main categories that you will most likely encounter in the NCLEX exam. Obviously, there are other categories of anticonvulsants, but I believe these are the main three that you will most likely encounter. Now, we're going to go over barbiturates, which is usually used for tonic-clonic seizures. Benzodiazepines, which is used as a CNS depressant, and hydantoins, which is mostly used for status epilepticus. Now, with barbiturates, phenobarbital, which is Lumina, and primidone, which is Mysoline, are the most common medications that you will most likely encounter in your NCLEX exam. And barbiturates are actually one of the most effective and widely used anticonvulsant. Okay. Now, side effects can include dizziness and drowsiness, and we do need to watch out for hypotension in our patients, right? Since it's a CNS depressant, right, and respiratory depression. Those are very important. Next are benzodiazepines, and the two most commonly used drugs are clonazepam or clonopine and diazepam, which is Valium. Now the thing with Valium is done. It's given IV push only, therefore we don't give it as an infusion. Okay, you have to be careful about that. And side effects for both these drugs would include ataxia, which is basically just an impaired balance or impaired coordination, right, in the patient. The main issue that we have, again, guys, I'm very sorry for the noise in the background. Now, the main problem that we have is drug dependency. Okay, so therefore we need to. It's basically a tolerance problem, right? So we do need to have patient teaching and proper guidelines, right, to teach our patient and telling them the harmful effects of dependency of benzodiazepines, and it as well can cause cardiovascular depression and drowsiness. Okay. Now, I'm just going to go fairly quickly with hydantoins. Now, hydantoin, uh, major drug is phenytoin, which is Dilantin, and it's a very major anti-seizure drug medication. And I believe that this is a very important drug. You might most likely encounter this drug in your NCLEX exam, so be very aware about that. Usually used for tonic-clonic or partial seizures, and it can be given PO or IV. Okay, now with IV intravenously, once it's given 30 minutes, it works 30 minutes after being administered through IV, and it's effective for 24 hours. Okay, and the thing with phenytoin is we do need to check the blood levels, right, in order to measure the proper dosage. Okay. Basically, beta adrenergic blockers are drugs that help lower the blood pressure, the pulse rate, and the cardiac output. Now, beta blockers are going to be an important set of drugs that you might encounter in your NCLEX exam, so try to make sure to pay close attention and take note about beta blockers. Now, sometimes beta blockers are used to treat migraine headaches and other vascular headaches. Other uses include treating glaucoma, and obviously is used to prevent myocardial infarctions. Okay, now try to remember that what beta blockers do is that basically they act by blocking the sympathetic vasomotor response in the body. For the NCLEX exam, Remember that the syllables for beta blockers is usually OLOL, right? OLOL. And the potential side effects of beta blockers would include orthostatic hypotension, bradycardia, nausea and vomiting, and diarrhea. And also some of the symptoms that can mask hypoglycemia, right? Now, hypoglycemic symptoms can include confusion, heart palpitations, excessive sweating, and anxiety, okay? Now, nursing interventions for clients taking beta blockers that you need to know is that we make sure that you monitor the client's blood pressure, the heart rate, and the rhythm before obviously administering the beta blocker drug. We also have to monitor the client's signs of edema, and the nurse should also assess the lung sounds for signs of rales or rhonchi, okay? Now, when our patient is taking beta blockers, it is also very important to monitor the lab values such as protein, BUN, and creatinine, okay, which can indicate a problem such as nephrotic syndrome, okay? Now, as nurses, you can do teaching to the client, such as telling patients to rise slowly due to orthostatic hypotension, which can be a safety issue, so that's very important. And also, we need to report signs of bradycardia, dizziness, confusion, or fever, because it can mask other problems. And also, it's important to taper this medication properly. So today we'll be talking about Synthroid or synthetic levothyroxine, which is basically a thyroid hormone therapy, right, that we give to patients with hypothyroidism, right? And as we all know, hypothyroidism is a condition in which there's an inadequate amount of circulating thyroid hormones, specifically the T3 and T4, right? T3 being tridothyronine and T4 being thyroxine, right? And basically this causes the decrease in the metabolic rate in the body, okay? Now, what we need to take note with Synthroid is that we do have to monitor the patient's cardiac system, because there's a significant cardiovascular disease that accompanies with a patient with hypothyroidism. And when we are giving thyroid hormone therapy, there's the client is at risk for cardiac complications if the metabolic rate is increased too quickly, right? Therefore, we do have to monitor the patient's cardiac system for cardiovascular compromise, okay? And we can see these symptoms such as manifesting as palpitations, maybe chest pain, shortness of breath, and obviously tachycardia and a rapid heart rate, okay? Again, I'm sorry, that's my daughter in the background. Also, with this medication, treatment begins slowly, and the dosage is increased every 2 to 3 weeks until obviously the desired response is obtained. And the treatment is also considered a lifelong treatment, okay? And obviously we're going to have an ongoing medical assessment of the thyroid function of the body. Now, also, I do want to point out that with clients receiving thyroid replacement therapy, they do need to be monitored for signs and symptoms of hyperthyroidism, right? Which can occur with over-medication. Now, these symptoms that I have here is actually symptoms for hypothyroidism, which, as we all know, weakness, fatigue, and weight gain. But like I mentioned before, we do have to monitor the patient for hyperthyroidism once we're giving the thyroid hormone therapy. And the signs and symptoms for hyperthyroidism is irritability, tremors, and tachycardia, and usually palpitations, okay? So again, guys, this medication is very important in the NCLEX exam. You do have to take note and be aware the important interventions, nursing interventions that we do have to know about for Synthroid, okay? Again, this is it for now, guys. I just want to make it short and sweet and straight to the point. I hope everybody's doing well. I will be making more videos from now on. It's just because life has just been very busy lately. Again, thank you so much, guys. I really, really, really do appreciate your time. Thank you so much for everything. God bless. Thank you. Bye-bye.